Hello, my name is Travis Gillum, and welcome to my presentation on my dashboard, which examines whether or not that government policies or the easing and ending of government policies impacts the new caseload and number of deaths associated with a state or region. So, to begin, the prompt for my presentation was begun from this particular article from Pew Research. And as you can see in here, it states that the American public believes that that governments have, whether it's state or federal governments, have lifted restrictions on public activities, public gatherings, restaurants, and other such things too early. With a grand total of 69% believing that the government was too quick in easing back on the coronavirus restrictions. So with that said, my thought process was, is there the ability to map this out using data analytics, in a way that either corroborates or disproves the public sentiments. So what we have here is we have a dashboard with a variety of different panes that I will explain one by one. This pane here that has the daily new case count per state is a snapshot view of the various different states in a bubble chart that will show you which states have the highest new case counts and which states obviously do not. Hovering over each individual bubble, you can see both the new case counts per day and the new deaths per day. And this is a snapshot in time from the 9th of August. I did that specifically because the 9th of August was the newest data set. However, this can be updated as needed to move this forward in time, so to speak. So then once you have this particular information, like you can see, California is the heaviest hit so far, with Florida and Texas following behind, but with states like Georgia and Louisiana falling not that for much further behind it. We take a look at these two data sets down here, and they come from the University of Washington, which has begun tracking the implementation dates and the easement dates and end dates of specific policies that either localities or states or even the federal government is enacting. Now, as we know, the federal government isn't enacting any specific policies as related to coronavirus. They are, however, issuing recommendations down at the state level, and that's essentially what you see here. What I've done here is I've broken out the top 5 policies and the top 5 policies coupled with states that have over 1,000 new coronavirus cases per day as of the 9th of August. So that includes California, Florida, Texas, Georgia, Louisiana, Tennessee, Illinois, North Carolina, Missouri, Alabama, and Indiana, in that order. The policies, the top 5, are bar restrictions, gathering restrictions, other business closures, restaurant restrictions, and stay-at-home orders. There were a variety of other policies that the University of Washington data set had, such as the utilization of masks, travel restrictions, and things along those lines. However, these were the most utilized and the most revoked. So the thought process was that the reduction, or that the utilization of data sets that were directly tied to impact. So I didn't want to include very underutilized policies and data sets because it wouldn't really track a general impact because very few states were using things like mask restrictions and travel restrictions. So what we have here in these two bottom quadrants is you have this particular chart here shows localities and state policies that were eased or ended during a specific period of time, from the 1st of March to the beginning of August. And then over here, you have specific dates that those policies were ended. It doesn't show you exactly what locality, but it gives you a general idea that, for instance, Florida had a pair of bar restriction policies, and both of those ended in April and in May, and then further gathering restrictions ended in April, May, and then in July, and that most of the policies associated with Florida ended in April and May. So what can you do with that? That leads us to this particular quadrant, the top right, where you can see the national trend for the new cases and the new deaths across a period of time, from the beginning of March till the end of July or beginning of August. And what you can see nationally, and this includes parts of Canada as well, so this is in North America. You can see that in North America in general, you had a uptick of coronavirus cases, new cases per day, and deaths per day that was fairly heavy during March, and then tapered off towards the middle to end of May, and then you saw a rise. And this corresponds to, at least anecdotally corresponds to, the restrictions that were generally lifted across large swaths of the United States and probably in parts of Canada. So where's the value? If we take this and we drill it down to a specific state, that's when we can really start to see what's happening. Now, Florida. Florida is a good example. You can see that as previously noted, in April and May, that restrictions were lifted for bar restrictions, gathering restrictions, business closures, restaurant restrictions, and stay-at-home orders. So as you can see, Florida, for the most part, they reopened with additionally some guidance associated, but the policy restrictions lifted in April and May. So with that said, you can see the trend line here, where in April, the number of new cases and new deaths were relatively flat. Same thing in May. And then sharply, about a month after the restrictions ended, and coincidentally the beginning of summer and travel season, you can see a tremendous increase in number of cases, from the vicinity of a little under 10,000 to all the way up to 83,000 per day in the week of the 12th of July. With corresponding growing death rates after that, with the understanding, of course, that coronavirus fatalities will happen probably within a week or so of the new caseload. So that kind of bears out across this as you see the trend line get darker to indicate increased death. So let's take a look at another state. We'll come across here to Missouri. Missouri isn't as population dense, and it isn't as big of a tourist attraction, so it might have a different trend line. And as you can see, what you have here is Missouri has a variety of policies that expire in June, and again in June for other business closures. So it looks like, based off of these dates, most of the restrictions that were in Missouri, they ended in and around. We'll look over here as well, Missouri. You can see the number of restrictions was lower as well. It looks like that fewer localities, or potentially even the whole state, was ordered. But that's not something this dashboard can really delineate. All you can really see here is that restrictions were put in place, and then they were released in June, towards the middle of June. So again, we'll take a look at this trend line. The trend line shows that you have increases in new cases throughout March, and then a stabilization or a flatten the curve here, with higher levels of death for whatever reason, potentially more overwhelmed medical systems. And then you can see here a slight uptick, but fairly flat up until the middle of June. And then at this point, you see new caseloads rise from around 1,800 to 9,000, over 9,000, almost 10,000 per day within the space of about a month and a half. So I think within that type of example, it is one of a good way of highlighting the impact of policy easement, and to a certain extent supports the conclusion that the public has made in that Pew Research article, that the coronavirus policies and procedures that were implemented and then eased by the government may have been eased too early. If we are just looking entirely at number of new cases and new deaths. Weaknesses to this approach is it doesn't take into considerations a variety of other factors, such as economic impact and population density. But I think this is a fairly narrow but interesting look at how policies have impacted the spread of this virus. So with that said, I thank you very much for joining me today, and happy data analytics.